Hi everyone, and welcome back to this month's version of the Healthspan Insider. So to kick off this month, we have an article that looks at, it's done in rats, but it's a study that looks at this gut-brain axis. And many of you will have heard about that. There's been a lot of research into this gut-brain axis over the last decade or so, and in particular to kind of understand mental well-being and how if you've got a grumpy gut, you have a grumpy mind, and vice versa. Grumpy mind gives you a grumpy gut. But also to understand more broadly what those systemic effects can be from having disruption to gut function and how that then influences the rest of the body. And so this was an interesting study. And as I say, it was done in mice, and it looked at some fairly novel areas of gut function. And so it's a little bit difficult to necessarily extend this into humans at this point in time, but it is another pathway that we can understand. And in this study particularly, what they found was that certain gut bugs that produce what we call medium chain fatty acids. We're usually fairly familiar with short chain fatty acids, which are a fuel source for the gut cells. But here we're talking about the production of these medium chain fatty acids. And these medium chain fatty acids have been shown to be a trigger for inflammatory pathways, things such as interleukin 6. Those inflammatory mediators can then influence the vagus nerve function. And now the signaling that's going up to the brain can start to impair cognition. Not just mental health, not just whether we feel happy or whether we have anxiety or depression or some other thing that's challenging our mental well-being, but our cognitive abilities, our ability to think, to process, and to remember. And in particular, it was found that an abundance of medium-chain fatty acid producing gut bacteria can in fact induce a more systemic inflammatory response that impairs the vagus nerve and therefore actually impairs memory function. So the key takeaway there is what we've always said for a long time is gut health first and foremost. It's one of our biggest pillars for ongoing health. And so as cognitive decline is a big issue for aging population, making sure that we're looking after the gut could go a long way to helping that. So following on from that one, this month, we had a look at a couple of drugs which we've known in the health span world for a while now. One of them is called rapamycin, and that's been used in health span and longevity fields as a way to regulate immune response, but it's taken at very, very low doses. And the other drug that was studied here was called metformin, and metformin is generally a drug that we use to control blood sugar in people with insulin resistance, type 2 diabetes, those sorts of things. And so what they wanted to do is compare the effects of rapamycin and metformin compared to caloric restriction, or let's call it, for the sake of it, fasting, okay? And so we've known for a long time that there are health benefits to fasting. And so intermittent fasting, whether you do a 16-8 or alternate day fasting, or if you do a 5-2 protocol, or some people do what's called caloric restriction, where they eat a normal calorie intake for X number of days per week, but then 2 to 4 days per week, for example, they will restrict those calories down quite significantly. And there has been a significant amount of research that has shown that caloric restriction does increase health span. But there's always the hunt for that magic pill that can do that for us. And so this study looked at whether using the pharmaceutical preparations rapamycin or metformin were as effective as fasting for extending health span. And again, this was done across not only humans, this was done across a whole bunch of, it was a meta-analysis of a whole bunch of studies that looked at animal studies, etc. But what it was found was that rapamycin was as effective as caloric restriction in extending lifespan and health span in invertebrates. whereas metformin did not show any ability to extend lifespan or health span. Now, that doesn't mean that metformin is not good, because they work on two different pathways. Effectively, rapamycin is going to influence nutrient sensing. And so that more closely mimics the fasting state of when you fast, then nutrient sensing is going to become more sensitive. When you're fed, then nutrient sensing doesn't need to be as strong, because the food is there. It can just pick out what it needs and move on. But where metformin doesn't work on nutrient sensing per se, metformin specifically helps to improve insulin sensitivity and therefore glucose regulation. And in terms of extending health span, it was not found to be equivalent to caloric restriction or fasting, where rapamycin was. Now, I think the key takeaway from this is we don't necessarily need to worry about taking pharmaceutical preparations and dealing with any potential side effects of those things. What we can do is, if appropriate, we can just simply implement intermittent fasting or some form of caloric restriction into our daily diet and lifestyle strategies, and therefore we are going to get the benefits of that health span extension from that strategy. So maybe start with the basics first, and then if you think it's appropriate, you can go and look at other options. And in the last one we'll talk about today, I find really quite interesting. We all know that reward comes from effort, but now that's been scientifically validated. And so reward, or the sense of reward, or the sense of accomplishment at the biochemical level is usually achieved because we have dopamine release, okay? And that dopamine release enables us to feel satisfaction from having achieved something. But what it was found is that if we put in effort to achieving whatever it is that we're trying to achieve, then we get the dopamine reward from that. Whereas if it comes easily to us and we didn't really have to put in too much effort, then we don't get that dopamine reward. Or at least we don't get it anywhere near as effectively as we do when we put in effort. And when they studied this down at the physiological level, what they found was that there is a relationship between dopamine and acetylcholine, which is another neurotransmitter. Particularly acetylcholine is one of our major neurotransmitters, so what runs most of our muscles, systems, etc. We get acetylcholine in the brain. And acetylcholine will potentiate the effect of dopamine. But we only get that acetylcholine effect when we put in the effort. And so by putting in effort, doing things that are perhaps not necessarily comfortable, or that actually require us to be motivated to get out there and do something, in the end gives us a greater sense of reward because of the effect of acetylcholine potentiating dopamine. So, get up, get out there, get it done is probably a way to feel more reward from your efforts. So some really interesting research there, some good strategies we can take away. Let's do the fasting, let's put the effort in, let's do the simple things first to extend that health span and that lifespan. And if you're interested, pop over to the blog, have a read through the other articles there, lots of interesting stuff, and I look forward to seeing you again next month.